feel like I was always drawn to science at a young age in middle school. So ended up having my mom feed that interest and get me into the Cleveland School of Science and Medicine, and really found my passion for medicine. I remember a program back in the ninth and 10th grade, the Wisdom Bridge Scholars Program, where we would go to the Cleveland Clinic early in the morning before school started at around 6 a.m. And we'd sit in on a team of neurosurgeons research meetings, and we'd learn a little bit about neurosurgery and neurology in general. And they'd have us present topics, and realizing how complex their presentations were compared to how simple ours were. Just getting into the field was sort of eye opening on how much there was to learn in medicine and how complex and interesting all of that was. And I feel like that was my first experience with medicine. I feel I feel like I definitely was super interested in science part first, especially in like middle school and early high school. I just really enjoyed learning complex topics, and science and medicine has a wealth of that. And then sitting in on those meetings and some of the experiences I had later on, and seeing how much this research, this learning pushed forward medicine and how it helped more and more people really opened my eyes into like, hey, I could also be a part of this and also start helping people. And during high school, I was a part of an internship, and we were working with stem cells and trying to make stem cells turn into red blood cells that could be used for transfusions for people, and seeing how important both donating blood and having blood to give to people to help when they're in need, when they're in accidents and things like that, really opened up my eyes into like how much need there is. It was pretty rigorous in terms of our science courses, of having like an advanced timeline, and I really just fell in love with all of my science classes, and the connections you have with the teachers there are, I feel, a lot stronger than they would be at other schools. I still catch up with my high school teachers today, and how important they were as mentors to me are beyond words. Well, both Case, Cleveland Clinic, and the museums are all right next to the John Hay, next to the high school, all within a few minutes walk. So we have a lot of connections between um, both Case West and Reserve, which is where I did that bench work research in 11th grade. And I actually ended up, because I went to Case, I ended up staying in that lab for the following 6 years and published a couple of pieces of work. And it would have been possible without that connection with the high school. As a junior in high school, I got to go observe a cath lab patient case and further feed my interest into medicine. And so all these connections being right next to all of these institutions is key, because as a high school student, travel is a big obstacle, and we're able to just walk. You just walk across the street and you're there. If I couldn't have made it to the Cleveland Clinic if it wasn't right next to school, it'd be pretty hard to like get there and then have a ride to get to school after. As medical students, as I led that year, we just walked the other way around. So we just walked towards the high school and went in, and went up to the science and medicine floor and taught there. And so it was kind of funny, like walking both directions, like whenever we'd visit the medical school as high school students, and then being a medical student, walking, like leading everybody, knowing the area, having been in the high school and college and medical school for like those 12 years, I knew the neighborhood really well. So I'd have all the medical student volunteers follow me, like, all right, let's come this way. Um, and I think that's super important, because medical students have very little extra time as it is. And so having proximity, saying, hey, we're a 5 minute walk, can you volunteer an hour? You're not going to have your time eaten up with traveling, driving. It'll be a 5 minute walk. We'll be walk back. We'll be done. Is really helpful in getting people to participate. Gearing up for senior year, we knew about the Joan C scholarship and to apply for that. And so my path was a little different than a typical path of sort of deciding in college that you're doing pre-med and then applying for medical school. I sort of had to make up my mind early. And so end of junior year, beginning of senior year, reflected a lot and really felt that medicine was a place for me with all those shadowing experiences I had. So I went for the Joan C. Edwards Scholarship, and the interview process is similar to how they would interview you for medical school rather than undergrad. Um, I'm grateful that I was selected as the Joan C. Edwards Scholar for my year. And then so I would basically be pre-med and take my undergrad classes, and then have a seat saved for me at the medical school at Case. So I was sort of already on the journey, and I had to have had my mind made up in high school. It's a program that sort of bridges the gap between high school students that go to school right next to Case Western Reserve University and the Case Western Medical School. And hardly anybody had gone to that medical school from the Cleveland School District before this program. The Robbins Bridge program was made to sort of have different experiences and different opportunities to get your foot in the door at the medical school and have different experiences there and sort of pique interest in medicine to get high school students to come to Case Western Medical School. And so some of these programs included the cardiovascular inquiry seminar series, and it was basically about a short course that was maybe 1 or 2 months. It was a weekly course on cardiology, and it was taught to high school students. And I remember taking part in my junior year in that program and having medical students come to the high school, volunteer, and they would teach us. We had a textbook, we had quizzes, and we'd learn all about cardiology and how important it was for health in terms of in like pathology like hypertension, heart attacks, chronic kidney disease, and things like that. And so we both get there's a public health aspect where you're educating a lot of high school students to think about their health and their parents' health. And then there's sort of the science and medicine aspect where you're getting to learn a lot about medicine before even leaving high school. And so I love that program, and it really pushed me to go for the Joan C. Edwards Scholarship. And so I got the opportunity while I was in medical school to teach the same course that I was a student in so many years ago. And so I led that course, I believe it was my second year of medical school. I led that course. I got us a cardiologist to come talk to the high school students of that year. It's really, really rewarding to like be on the other side and give back. You know, when I was a high school student, it was inspiring to see like, oh, a doctor's coming to talk to us in high school. The interest that brings, or like that us as high school students feel important enough that a doctor's coming to talk with us, coming all the way to the high school to talk with us. We're not used to that, having that happen. And so I feel like that's really important, especially even the medical, like having medical students, like, oh, well, these are med students. They're about to be doctors and they're all just coming over here to teach us. And as a medical student later on, I realized, we think they're probably not even listening, but I knew when I was a high school student, like, this was way more interesting than any other class I was in, and it was really important. And I had listened to what they had to say because these were doctors and people that really were interested in science and helping, and nobody like that ever comes down to the high school. And so that was really inspiring for us. We learn a little bit in medical school. We have some training, but having some training and having like a short course on like different socioeconomic factors is much different than having people that experience those factors and can say, hey, proximity, transportation being an obstacle is a huge obstacle to healthcare, and finding ways to get around that to lessen that obstacle is key to getting patients and things of that nature, like things you might not think of because you don't have someone in the room with you, is like the crux of the problem. And so really having all manners of socioeconomic class and races in the room with you as medical students, as your colleagues, is really key. Because hearing it in lecture is one thing, hearing it from your peer next to you, like, hey, I didn't have a car, couldn't get to X, Y, and Z. That's why I never made it to any appointments. But I didn't want to tell the doctor or something like that, right? Is like much more impactful as a medical student to hear from your peers, like, hey, this is a barrier than on a slide. I don't have parents that went to college. I'm the first generation college graduate, first generation medical school, et cetera, et cetera. And so I don't have anyone to ask, how do you do X, Y, and Z? How do you get through med school? What's pre-med? I knew nothing in high schools. And that's probably a lot different than a lot of my peers in medical school who might have parents or uncles or whoever that are in medicine who could tell them, hey, you need X, Y, and Z. Hey, there's a lot of loans. Hey, there's 4 years of undergrad, then 4 years of medical school, then there's residency. And I didn't understand any of that. So I had to come in with a blank slate growing up. Trying to learn things on my own was a requirement. It was definitely isolating at times, realizing just how different worlds these places can be. was sometimes isolating, but I also took it as opportunities to like talk to my peers, realizing that we're a large group of future physicians that are going to go all over the country. And as we are as medical students and residents, are how we're going to practice medicine pretty much for the rest of your career. And so opening my colleagues' eyes to like different experiences of like a public school student. Everyone's always surprised when I'm like, oh yeah, I went to John Hay in medical school. Even through residency, some of the attending physicians I'd work with, if the topic ever came up, like, oh yeah, I went to the high school down the street, and it's always, oh, I've never met anyone from this high school, and so like usually I'm the first person they might meet from the Cleveland Metropolitan School District as a doctor, as a resident, and so sometimes isolating, but I always took it as an opportunity to educate my peers and open people's eyes. I have a lot of siblings. I have three younger sisters, a set of twins who are now entering their senior year, which makes me feel old, of high school, and the youngest sister who's in middle school. And then I had my younger brother who's about a year younger than me. He passed my second year of college. And so he is a big part of what kept me going. And so there was a hard time in undergrad of that year to get through, but he's sort of what keeps me running and what inspired me to become a pediatrician. In high school, I always thought maybe neurosurgery because of that Wisdom Bridge program. And then during medical school, I had my pediatrics rotation. And a lot of the times it reminded me of my brother and realizing how important children's health is to our future. And so I wanted to be a part of that. And so I keep him with me and he's my inspiration. It definitely has impacted on how I relate to my patients and how I prioritize the things in my life, realizing how precious life is and how hard things can be when you experience loss like that. And so I use that as a physician. So as a resident, we'd rotate through all the different parts of the hospital. And so when I was in the ICU, there was a lot of loss and things like that. And so I'd use that to empathize with the parents, empathize with the patient. And so I do use that experience. And I feel like it's helped me greatly in being able to empathize with my patients. I really enjoyed pediatrics, especially as a generalist, so as a primary care, because we so lack primary care doctors from different socioeconomic backgrounds. I felt that was really an area that I was needed. And so I sort of get to follow my patients throughout their life, throughout their childhood at least, and hopefully set them up for success in the small ways that I can whenever they come to visit me. I will say, because as primary care physicians and as a pediatrician, you sort of make the least amount of money. So, you know, people say, oh, you're talking about money as a doctor, but as a doctor, you took a lot of loans usually. So most of my colleagues, they will leave medical school with maybe $500,000 of loans. And so you want to, most people would think to themselves as medical students, although of course what you're passionate about plays the most important role, thinking about, hey, I need to pay off my loan at least. And pediatricians don't really get to do that as much. So unless you went to a sort of lower cost medical school and you specialized as a pediatrician, which is often what happens. So a lot of pediatricians will specialize, do pediatric cardiology, pediatric neurology, all of these things which are super important, and we need all of these specialists. Sort of leaves primary care as a little bit more empty. And so I'm grateful that I had the Joan C. Scholarship where I don't have any student loans. And so the field was wide open. I could pick whatever I wanted and not have to worry about paying off $500,000 of loans. And so I didn't have to like worry, like, because of course I wanted to do primary care pediatrics. Maybe some of my colleagues would have wanted to, but were limited. They couldn't realistically go into that field without never getting out of debt. Yeah. So I'm very grateful. In residency, where you're sort of done with the Jones C. Edwards, but because this foundation is so amazing and the people that work in it are so awesome, I still caught up with everybody. I would join our meetings on how everyone is doing. And so I did it both to help me have some people that I could talk to and relate to. Sort of as I talked earlier, medical school and residency can be pretty isolating, being from a different class than everybody else in the program. So getting to talk with peers that came from the same high school, usually the same socioeconomic class, was something for me, but also to sort of show the younger Joan C. scholars who haven't made it to medical school or residency yet that there's a lot of challenges that they might not know about. Because I remember myself in high school and college not knowing anything about medical school